All right. Lord God Almighty, thank you for the opportunity to once again come before you in service to the people of this county and specifically for the nursing center and the folks that work there, the folks that live there. Just to pray that you would give us wisdom and discernment, how to handle decisions we need to make, information we need to share. And may we do that amicably and respect consideration. I thank you for this opportunity. Pray that you bless it. Jesus. Amen.
3.0 approval of tonight's agenda. Do I have a motion to approve?
I would move to approve.
Do I have a second? I second that. And Ms. Figure, all those in favor say aye.
Aye.
4.0 review and approval of meeting minutes from September 12th, 2024. I have a motion to approve.
So move.
Second.
Second by Mr. Hadley. Any discussion? Seeing none, all those in favor say aye.
Aye.
Opposed? 5.0 approval of tonight's claims and cash requirements and manuals is $254,629.65. We have a motion to approve.
Motion to approve.
Second.
Any discussion? None, all those in favor say aye.
Aye.
Opposed? 6.0 public comment. All right, seeing none, moving on to 7.0 reports to committee. Mr. Perez, you're up.
All right. So this, my report this month is reflective of my second month of oversight of the facility as far as facility operations. And the format I'll follow this month will be the same as it was previous month. And as I said in the previous month, for the purposes or for all members of this committee, if there's any other additional information regarding facility operation that you'd like me to include in my report, feel free to let me know that and I will incorporate that into my monthly report. When I created this agenda, our current census at that time was 42. We are, as I reported last month, my current goal for the facility for the short term is to get up to 50, and then we would go from there. Thankfully, our referrals from our various referral sources, primarily our hospital systems that we work with, including FHN here in town, has bumped up a little bit. We actually had kind of a flurry of activity in the facility today with 2 hospital returns, residents that were sent out to the hospital for different periods of time for different reasons. Have returned today, also a brand new admission to the facility today. Our marketing and admissions director, Jeannie Cross, is very well connected with the referral sources that we work with here in the area, such that, again, just trying to coordinate the flow of referrals and getting them processed. When we look at referrals, just as kind of, I guess, kind of an educational piece, when we look at referrals, we look at them from a clinical and financial aspect. So the business office will run their insurance just to kind of confirm what insurance they would have to cover either a short-term or a long-term stay. And then, of course, the director of nursing would look at from a clinical standpoint as far as our clinical capabilities, if we will be able to properly care for that particular resident's needs. So that's pretty much what goes into that. I've communicated to primarily those 2 members of management more recently that ideally within 30 minutes we would have a referral from any referral source processed within that amount of time, so we can get back to the hospital or whoever it may be to give a decision as far as whether we were going to admit that person or not. Just to try to give that benefit to our referral sources for a quick turnaround time on the review of referrals. Currently, at this time, we have 39 residents in-house, 2 that returned today, so that's 41. 1 new admission, which is 42, and then 3 still in the hospital, so that's 45. So we're slowly inching back up towards that 50 mark, and then we'll, as I've told the management team, then we would go from there and probably head towards 60 next, and then go beyond that, but one step at a time at this point. So that's kind of my game plan, at least in the meantime. For that 42, though, that I had projected at the time of this writing, our average monthly census for September, now that we're in October, was 40. So just looking at it from an average overall census standpoint as well. And as I gave this committee last month, kind of a breakdown as far as individual payer sources. Remember that when it comes to nursing home residents, we're usually going to be talking about either a short-term or a long-term stay. most of the residents in any nursing facility will be there on a long-term stay. When you look at the Medicare, what's listed there as Medicare A, what I've listed as Medicare A traditional or Medicare A replacement. As I said last month, remember that with traditional, that's just the traditional Medicare Part A benefit for those to come in and receive short-term skilled nursing and rehabilitation. So a short-term stay. The replacement, the Medicare replacements are Medicare A replacements are those that have sold out their Medicare A benefits to an insurance company who will then dictate the amount of time they have for short-term skilled nursing and rehabilitation. So that's really the primary difference as far as how I look at it outside of reimbursement or anything on that level. So Medicaid then, as you can see next listed there as well, are for those residents that would then live long-term. Medicaid typically covers for a long-term stay in a skilled nursing facility. So, and traditionally in most traditional skilled nursing facilities, Medicaid, you'll see mostly Medicaid population and also some private pay, depending. And you'll see they're listed beneath the Medicaid recipients, also private pay, and then private pay individuals that are covered under the hospice benefit, receiving hospice care for end-of-life care, but just pay privately as well, as far as for room and board. So you can see from those numbers there that most of what we have are individuals that are under the Medicaid long-term, I think of long-term benefit. The state of Illinois and the federal government at this point are still at this point trying to push towards individuals, whether it be for their Medicare benefits or Medicaid, to have insurance companies manage their benefits, primarily, at least, correct me if I'm wrong, but primarily for a cost-saving measure. Even for me, I'm 42 years old, and by the time I get to retirement age, I mean, I think the question for a long time is that they'll, Medicare and Medicaid will even still be there by that point, to serve my needs, when I get to that point. So, but as I said, I've always looked at it kind of from a cost-saving measure for Medicare or Medicaid to have insurance companies dictate as far as what length of coverage an individual might have for a short-term or even in some ways for a long-term stay too. So that's kind of the primary difference as far as how I look at that from that perspective. Again, either short-term or long-term in the facility. From a personnel management standpoint, as I was asked to include this as well, from the previous month, as far as new hires and terminations, not too much of a difference from August, actually, I guess it would have been going, and then comparing it to now September. As far as the number of new hires and the number of terminations, I had reported, I think last month as well, that we would continue to focus on staff turnover, decreasing staff turnover. I talked to the management team as a whole, especially those that have a staff themselves. The director of nursing, the environmental services director for the housekeeping and laundry staff, the activity director for her staff, as far as employee incentive, employee recognition programs, outside of anything that might already be covered in the collective bargaining agreement for those union staff, which is the majority of who works at the facility. But just trying to put in new ways to recognize our staff and let them know that that the county in this case is their employer, and the management team, as far as the administrator on down, recognizes what they do and sees the importance of the fact that we couldn't operate without what they do on a daily basis. So new programs we put into place as far as employee recognition. There is, as I've seen it, there is a budget in place for employee incentives or employee recognition as well. So we can, use that, I guess, as we need to, as far as those sorts of programs for staff to try to bring down employee turnover. Because as I've always believed myself, the people that we hire are a very valued resource, and it costs a certain amount of money for turnover in any organization. So that's just more of the reason to try to better the overall level of stability as far as employee longevity for the facility as a whole, to benefit even the residents that we take care of on a daily basis. So there's a lot that goes into that, obviously, but we're focusing on that as well. Number 3, from a regulatory standpoint, as far as the Illinois Department of Public Health, which is the state regulatory agency that regulates skilled nursing facilities that receive Medicare and Medicaid funds. Thankfully, nothing to report at this point. No survey activity. As I continue to remind the management team every day, and even the frontline staff for their part, that we are getting ready for our annual survey, which I expect to be within the next few months, more than likely. And again, just as a reminder for this committee, you know, as far as that process, when a team of what are called health facility surveillance nurses come into the facility, they will analyze every department that we have. The first thing they usually do when they come into a facility is hit the kitchen, as far as food service areas for, you know, sanitary conditions and such as that. But again, they will look at every department that we have, the quality of our activity programs, nursing services as a whole that are provided by the licensed and certified nursing staff. Literally everything that we do, they will look at. So, but I expect a good outcome from that survey. The facility has a very good survey history as a whole, just historically. And so I intend to repeat that as well for this cycle now too, going into my first annual survey with the facility. So again, nothing really to report there, thankfully, at this time, as far as the state is concerned, as far as the Department of Public Health. The maintenance director, as normal, as well, had submitted his maintenance report. Just to note, Mr. Chairman, as you had asked last month, as far as the what I guess what I would call the continuing HVAC work, that is still in progress. That will still be accomplished this year. There, as I reported last month, there is or was and still is a little bit of a wait time, a lead time for the two remaining larger rooftop units that would be installed. So I expect that to happen within the next week or two, more than likely, at least for what I'm aware of at this point. And so, to the best of my knowledge, that project should again still be completed this year, as far as what that is. So that's my expectation at this point. Yes, sir.
The maintenance report is August of 2024. I think it's the same maintenance report we got last month. I think.
Well, it shouldn't be. It shouldn't be.
Because this was for the month of August, and I think I remember reading the same stuff.
Maybe he submitted the wrong one.
Okay.
Much of what he covers is always the same, as far as, you know, fire drills, generator tests, things like that. There were no major changes with regard to any of those areas that he oversees. Nothing that I would report to the committee this month in this case. But if that was mistakenly included as far as the wrong month in this case, we can correct that.
Okay.
As far as his report for this month in this case, so I apologize.
Would it be the month of September? He would have a report, or
what's that? I'm sorry.
The September report. This is an August report. What
he does have a September report.
Oh, okay.
So he might have mistakenly sent the wrong one.
Okay, then.
So I apologize for that.
Well, that's okay.
Okay, we can have the September one. Maybe
if you have it, would that be sent out, please?
Okay.
Then, because this one said that the HVAC looks like installed time frame has been pushed back to the week of September 9th. So
that would be further back, right? So
So-
you're right. That is not the most up-to-date report.
so now it's been pushed back further. Then.
Well, as I said, in this case, it was a 4 to 6 4 to 6 week wait or lead time from an August date. So as I mentioned just a little bit earlier, probably within the next week or two, I expect that work to be completed
Okay.
at this point. So there shouldn't be much time left on that. Like I said, that project will still be completed this year, very shortly in this case. So,
Okay, thank you.
as far as our safety committee meeting and review from that perspective, again, with the exception of one employee that had one injury related to resident handling in this case, there was no other major claims that I was aware of. As far as anything new, I did receive communications from the work comp carrier, though, more recently with regard to one that I think took place in 2015, which I think is still in process at this time. So, Denise, I think you would maybe suggest that they give me more of a detailed briefing, maybe with regard to that. But
sounds like that's going to be settled fairly.
Yeah.
We just sent that today. Yeah.
But- sorry, but again, from a safety standpoint, no new items with regard to that, at least at this time. As far as capital expenses, 6A in this case, looking at, again, the HVAC work that is, again, as I said, will still be completed still within the current fiscal year. I did not submit at this time any supplemental requests for the new fiscal year. Just simply because as my understanding as it is at this point, with budgets being tight for the new fiscal year, and just with my intention to get other projects done within the current fiscal year, seeing how much funds we have available to us after even the HVAC work is completed. So that's still kind of up in the air as it is right now, unless anything else is pressing. So with regard to that. On 6B, just to report to the committee that the facility in the time now that I've been overseeing things has been subjected to audits by the federal government, in this case, looking at individuals that were under a short-term stay as far as how they were billed for their utilizing their Medicare benefits, and looking at the possibility of recoupment if everything wasn't as it should be as far as certain documentation. So those are still ongoing at this point, working with individuals within the management company as to those processes and getting those cleared at this point, so we can get past that as far as what those are at this time. So,
And those are nationwide. CMS is asking for 5 charts from every nursing home across the country. So they're not targeting anyone, they're targeting everyone.
on 6C, I already kind of mentioned the supplemental requests or the status of those. And then finally, Mr. Chairman, under 6D, as far as you would ask last one, as far as the VA agreement, the individual member of the management company has, that Charles Ross, who's been working with the VA, has set up their first initial meeting next Monday, which I will be part of. So to try to hopefully get that ball rolling with regard to that as well.
I have a follow-up question. I'm a member of the VFW Post, and the VFW, the American Legions, and AMVETS, we all meet about the same time. I know in different counties, does it help to have a letter from our local VFW Post, our American Legions and AMVETS for the show support of that?
Any thoughts on that one?
Maybe it certainly doesn't hurt, but I don't think we're there yet. I think we have this initial meeting.
Okay, well, you could ask that question.
It wouldn't, yeah, it wouldn't hurt.
Because Chairman Helms, the city manager is, I think the vice of American Legions or AMVETS or something, so I know he would probably be very helpful, if we need letters, I go to the meetings monthly and, I haven't brought it up, but I heard that letters would help you, so.
More than likely would not hurt.
Yeah.
So I think what will happen is we'll have that initial meeting with them,
Okay,
and I'll see if I can maybe field them out, maybe in that way too, along with Charles Ross, who's in that meeting, and see where we can go
and
from.
maybe the VAC too, that we have, the organization,
Oh,
the
yeah.
VAC we have, so.
That was as far as 6D, as far as the VA agreement, that was my final item, but I would just for the record, as far as this report for this month, just know that as far as my daily focus, weekly focus, monthly focus, continue to work on the reduced utilization on contracted nursing staff, which has been in place since prior to my arrival. Again, decreased utilization just because of the costs involved with contracted staff. Also trying to fill positions, primarily nursing positions, certified and licensed nursing positions, to bring down our utilization on overtime and just costs related to that, as well as far as staffing costs as it relates to that. Increasing our census, obviously census development is a big priority right now as well. Again, right now trying to work towards 50 residents. I have told the management team that we will go back to the way things used to be as far as filling that entire building and making use of both parts of the facility, not just half as it is right now, and then getting used to that again. So those are kind of my areas of focus right now for the facility as a whole, keeping also the state out of the building, keeping us regulatory or keeping us compliant or operating within compliance, continuing to work in that way. So that's what I would report this month. So.
Great, thanks. Anybody have any questions for Marcos?
Well, sir. Thank you.
Yeah, I do.
Yeah.
I noticed you put the stars in here.
I did. I started to include that this month, and I'll include it every month. Those are Stephenson, our own facility, and 9 others based on distance, as far as in the geographic area. You can see our overall star rating as our facility, and every other listed there, along with the 3 areas that's broken down into, which would be each facility's survey history, the staffing level as we report per the payroll-based journal data, and then also our quality measures, which is basically all of our clinical documentation that we submit at least on a quarterly basis. But again, the main points I take from that are just our overall rating as we compare to other facilities, And here in Freeport, to begin with, it's us and Liberty Village that are kind of in the lead there as a whole. And I intend to, for our facility to go back up to being a 4 or 5-star facility. I also included in there as well the actual report from the federal government that is put out each month that the management company provides to me as well for our kind of more of a detailed breakdown as far as our star rating. So that's with that as well too. So if you want to look at other facilities in the area there, I do include those.
Yeah, I see that we're, right up there with Liberty Village, but on the staffing, we have a 2, what constitutes,
So that
staffing.
data is, I said that data is reported each quarter. And actually the next deadline is November 14th for that data to be reported. The member of the management company that correct me if I'm wrong, but compiles that information based off of our payroll data, and then also from our usage, our reliance on our contracted agency staff. So reports that we get from them all goes into that as far as our staffing utilization or our staffing levels. So we should hopefully show differently on the next quarter when that comes out.
And these come out quarterly or?
They do come out quarterly, but we're
Okay.
usually a quarter behind with those reports. So,
Okay.
that the government puts out, the federal government puts out.
And then I see CMS has their report too for September.
Yes, that's the more detailed report from the Centers for Medicare and Medicaid Services that oversees all skilled nursing facilities nationwide that receive Medicare and Medicaid. That's just a more of a detailed breakdown of survey history and for our facility, survey history, staffing levels, and our quality measures.
Okay, thank you. That's all I have.
Hey, let's start with the August, August came in at a 45,800. Down about 15,000 from year to date. The facility has a loss of 27,037. Certainly have enough time left in the year to get back to a profit. September will not be that long. I think August is based on about a census of 42. I think like Marco said, we're in the 40, 41 range for September, but October, November, December, we get the census up. And we'll be back in situation. Any questions on the P&L? Going to the aging report. Total accounts receivable is $1,167.73. Our 12-month and older category is at $280,496.94. We will be submitting more write-offs to this committee next month. Will be larger than the last. Little good news on the write-off. We are expecting a check for a little over $14,000 back from EMS for our cost reports. In the cost report, there's a section for write-offs. And assuming that you've done the write-offs correctly per some normalized policy, there's a point in time where you can report them on the cost report and get back like 65 cents on the dollar. So I don't think that was ever done before, but we started that as soon as we could. And so this year, any day now, really, we should get a check for a little over 14,000. Questions on that? AR?
Two quick ones, if I may. How much of that will be the resident share of 109,648? To me, that unless that's coming in from our efforts to go after some of these folks,
Yeah, I'd say
third party,
I'd say that probably will represent the biggest part of it.
biggest chunk.
Yeah.
And then secondly, on the Meridian Healthcare Plan Inc. line, what is the number there? Because mine just shows a bunch of dollar numbers. I think that was a big parenthesis last time I remember.
Yeah. thousand plus. Second.
And that still represents a misalignment with matrix somehow?
Yeah, what we have been finding is that the dollars that were booked, and this is from years ago, booked into the software system. Let me give you an example. Let's say $10,000 was booked for a patient, and we received 11,000. So that would show us $1,000 that we go back to Meridian. But on looking further, it was the wrong daily rate within our software system. So we really should have billed for 11,000. That's why we got paid 11,000 instead of 10, because Meridian had the correct rate in their system. We didn't have the correct rate in our system. So most of that bracket will disappear. We've actually received the money years ago, and we just have to verify that all the rates, we have to put the rates back in at the correct level. So it's kind of a fake bracket. Yeah, originally we were afraid we actually owed the money back, but now we're finding that we already received it.
It's $100,248.88.
Thank you.
Moving on to the cash flow. Let's see. We believe we're gonna end the year. So we received, I believe, almost all of the levy money up to this point. It's 90%, probably 95%. And we believe that we're gonna end the year somewhere in the 600 to 700,000 negative range. Improvement from the building. But kind of due to the downturn over the last few months in profit loss, we'll crimp and planning to get back to break. So we'll certainly be better off at the end of this year than we were at the end of last year, but won't be able to get out of it. Questions on cash flow? I think that's all I have.
Moving on, 8.0 new business, no new business, so 9.0 old business. Discussion and approval of the proposed FY 2025 budget. This has been on our agenda for a while. Anybody have any?
About that update.
Oh, yes.
I presented printed copies because there was updates just entered after we got those final numbers from Ms. McBride, were emailed out late this afternoon. So the health insurance numbers and liability and work comp numbers have been updated to by.
Good numbers.
They are good numbers.
I was gonna ask you a question. I was hoping that they were updated. It looks like altogether with workman's comp and liability was 233,494. What was it last year?
There's a difference. I think Nicole has the information.
It's almost 400,000.
Yeah.
Yeah, so 398,000 and change combined with workers' comp.
So that's a huge decrease. And what we owe that for? What, did we hear anything yet?
There was some claims that had fallen off the cycle, and haven't been claims this year that have historically happened for work comp, so.
Their census may have been down a little bit too. I think we started in 23 with about 60. Just thinking of.
On the health insurance, you plugged in 475. what was it last year that we plugged in? Let's see,
432,700.
how much?
432,700 was the 2024. Right next, right to the left of there.
Okay. Okay, hold on, yeah,
So with health insurance numbers, I mean, it is a guessing game with employee turnover and which plan they're going to pick, but between, using as many factors as we can to get it as close as we can.
what have we, what do we use for average employee? Is that what you do, is use for average?
It's the game of, we have an average employees and the percentage of how many employees are enrolled in each plan.
Okay,
So we just kind of,
As you got three different
Configure that
plans,
month to
now you
month.
get the add one.
right, and it's a monthly total that we then take, divided out by the year. I mean, it's a guessing game, but it's as accurate as we can educationally guess it at.
what do we have for employees again out there total right now?
67.
67, and they're all in different types of programs. But the majority of them are in, it looks like there's one, if I looked at the insurance paperwork, it looks like a lot of them are in more, it looks like there's more in one of the programs than the other programs, it looks like.
So last year's numbers were based on, at the point when we were putting together the budget, we weren't sure who was enrolling in what programs, so we kind of guessed at everyone enrolling in the catalog plan and carrying over as close to coverage as they can. The employees, after sitting down with the broker and going through things, a lot of them opted into the FSA plan with that flexible health savings that lowered the guessing,
Right.
because
Got some history now.
now he's like, okay, now we know how many people enrolled in that.
So we're showing a net in this budget of 119,000.
Thank you to those insurance companies.
Okay. So if everything goes accordingly, we should have a surplus next year. With the number 47.
My turn.
Sure, go for it.
Do we know what the average census has been this year? Well,
I have not ran that,
do you recall?
but I can grab that. I can grab that number.
I think TCM should have.
Yeah, it's in the, days.
We were in the 30s there for a while.
2009. $45.111.
Yeah, that's the only thing I would say on the overall is it makes me just a little bit hesitant on 47. I'd rather budget conservatively and overcome that. We're at 40 right now, even though we're looking to get to 42 here. Still, we've got some work to do to get up beyond that because it is going to fluctuate. We know that. We've seen it from the historical standpoint. And like we did last year, we want to drop in that number, I think, 2 or 3 from where we started. Well, yeah. So we hit that pretty close. So anyway, I'm good, I guess, with leaving that there. The only other questions I had, there's still 249 on the private pay line, and we have nobody in private pay right now.
Right, the private pay rate is exactly the same as the Medicaid rate. So. The
Is that
47
just your
expenses,
expectation? We're gonna get a couple private pay people, or?
well, I don't know, to be honest with you, we're taking 47. And it doesn't matter if 0, 1, 2, 3, or
Whether
4.
it's in
our private pay, because it's the same rate as Medicaid.
Good, just curious. And then the managed care. We're gonna, we budgeted 292, that's up about 100,000. Curious why that, I mean, the year before it was 650, so that seems reasonable. Yeah, that was the only other question I had. You know why that,
So the managed care and the Medicare Part A, twins,
okay,
so,
so that's an either or type thing too,
right.
taking your best guess. That's all.
Well, motion to approve the budget.
I would second that.
All right, any further discussion? Seeing none, all those in favor say aye.
Aye.
Carries. 10.0, public comment. Rory. That's the one.
Mr. Bush?
Miss 11, or to
Right there.
amendment.
Oh.
And Mr. Flynn, can I have a second? And Mr. Whalen, any discussion on that? All right. Those in favor say aye.
Yeah, that's the.
Motion to
that's the
adjourn.
one, just- Good work.